Good morning, everyone. It will be boring for you because we are talking about very like a hi-fi things and very urban things and technology, but I am talking about very rural health. In this place where the Manan in the Tamil in Kathmandu, but I am talking about lot of Manans in Nepal. The Manans, Mustans, Golma, I am talking about that. So sorry for that. I am talking about just Professor Shivakumar said that challenge itself has the opportunities. And then it has solutions. Each time the challenge, there is always the solutions. In the womb of this challenge. So we have to try and try. Next, please. We have to go along. This is my car. I have to go like that to cross all these mountains. Maybe 8 hours, 9 hours to do a small health camp. We just talk about the health camp, the physical camp. Yes, the previous presenters. This is the physical camp. We have to do. Next, please. And I am not talking about the very much things, but I am talking about what is the national scenario and what will be the model in rural areas. That is the two things. That is going by the NGO. Next, please. यो एउटा भनाइ मैलेरै भनाइयो पैसाको रूप हुँदैन पैसाको हामीसँग छैन र सबै पैसाको रूपबाट पैसा टिपौँ र आवश्यकता पुरा गरौँ रुखको पात त टिप्दै गएपछि सकिन्छ अनि पैसाको त पैसालाई त कसरी पुर्याउँ तर पैसालाई सही योजना र उचित ढङ्गले खर्च गर्यो भने थोरै पैसाले पनि धेरै आवश्यकताहरू पुरा गर्न सकिन्छ हाम्रो समस्या त्यही नै अब I'm talking about this magic like statistics of Nepal. That what they said, 83% people are in rural areas in 2011. There was magic in 10 years. They said that only 33% of these people are in rural areas. This is very controversial. In 2072, the new constitution came and they made all these areas and the municipality. They also made the urban. But I saw those places where there is no water, there is no light, there is nothing. But they say that the urban areas. In my view, there is not 83%. 80% of rural population are in the village. Only 20% people are using all the resources of the Nepal. Not only the health. Yes, please. So, this is the challenge. We are always talking about development, but road, electricity, telephone, mobile phone. These are all the, we say that is the development. But in my view, this is the not development. Development should be in the mental, physical, emotional, all the people, people of the health of the people, and the attitude. And the attitude. Professor said me that, I heard that, this previous presentation, that attitude. And all these are come in the way of the development if we have the very positive attitude. And the challenge, I'm talking about, we have very less attitude about that. So, 3% of people are covered in health insurance, but they are insured, they have to travel 8 hours and spending 4,000 rupees to do the one ultrasound for 500 rupees. That is the scenario of Nepal in rural Nepal. What in Ramesaki is now still this condition. And the people are very poor. They are very less income, but very less capacity to pay. Now this is all the things what I have not to talk more. Geographical conditions, less health resources, less this was like drinking water, sanitation things, and 40% lands, fertile lands are now empty. Nobody is there to work in the fertile land. It goes to the nutrition part and it goes to the poverty. Next please. Next, this is the thing. Why I'm there showing this is, when we started one organization 41 years ago, we are talking about the primary health care for all, I think 1970. We started 41 years ago. I just remember one person, Mr. Jagadish Kimire, who was in the UK, and he started one organization in Ramesha. There was no road. We have to walk 3.5 days to reach the Ramesha from Kathmandu. And he started this organization, and he started to work the community development. And I, with this organization from 31 years ago, I went there. There was no road, there was no electricity, there was no drinking water, nothing was there. But we started this work. And why I am showing this? Because this primary healthcare things, we crossed this Millennium Development Goal, and from 2016 we are coming the next part in 2030. And all the things change you see. The government, I think this is because of democracy as well. Because the government, the people, and the NGOs and INGOs, they came to work together, and they did this. So we have some part of this in Ramesar district, because in that time, our staff was more than 300, and our development budget was more than the district development committee, and we did lots of all the things like this. Next please. Next please. So you have the very good opportunities, not only the challenge. People ever have about the health. There are local governments, they have the committees for the health institutions, and there are lots of money coming from the outside. The people from every villages, I think one person. You cannot imagine that we have about 45,000 households, about 38,000 people are outside. That means from one house, one person. But there is a positive to our health. If we give some good health service to them, they can pay for that. So it is a good indication, but it is not a permanent solution. And there are school nurses in these schools, and we are talking from the very beginning from these schools about their health. Next please. This is promotion of development facilities in province, district and local governments, then infrastructure development. Next please. And they have the women research development colleges, and we have this college like a next please. This is the health system after the constitution. Federal, province, and then local. Next please. And in 2017, the government said that we have 4 things, like physical infrastructure, equipment, service, and human resources. But there is lacking some part there. Just Professor Shivakumar mentioned that one is the research, one is the population. They are making all the things in their paper. Yes, but they are not coming from the outside from the paper. Yes, please. And there is the primary health care center, primary hospital will be there like this. There are rural municipal hospital like this. Next please. And they said this, all the things we have to do, we'll do that. Next please. And we learned something from the 41 years. We started this organization. To join the small groups of the women. Because in that time, you cannot imagine, when you went for to work there, the women life expectancy was 49 years, and the literacy rate was only 2%. It was very challenging. And maternal mortality said that by the Nepal government, it was about 600, but UNICEF said that it was more than 1,500. And we were, I think, in there. When I was there was vaccinated babies always in their home, and they have to come in the back of the people, and they have to work 1.5 days. Is the obstetric labor, and the babies vaccinated. It was like that. So how we can do? We have to do like this, maybe the women's groups in the villages, and provide all the things, basic health, sanitation, heavy planning, awareness, income generation, sustainable agriculture, agroforestry, literacy. It has all these things which helps to improve the health of the people. We started like that from the women. Next please. And this is all the things. And now I have to say that we have the 17 organizations. More than 60 we developed, and now we have more than 2 arab rupiah. 2 arab rupiah. रामेसाबको त्यो गरिब भनेको जिल्लामा झन् 2 अरब रुपियाँ अहिले उनीहरूले चलाउनु पर्छ। र यी सबै कुराहरू why we are doing this? You said 40,000 people are drinking water in their house from our organization. Only there are 170,000 population, more than 40,000 they are using that. And I said already about this 5,000 households, more than 22,000 households made the toilet there. Next please. And we have the sustainable primary hospital we are making that. 25 years ago, we made a primary healthcare center, and then 18 years ago we made a primary center, and we are doing like all the things. Next please. And we have a specialized center. It is very interesting that you told about that there's all the technology. Now all the people have their phone, and they are coming from the 8 hours driving to consult with the physician, but they need the help of cardiologist, they need the help of gastrologist, and they need the help of the psychiatrist. What we are doing now with that is we just collect the message, and the tertiary care centers, hospitals, they help us. They send the doctors every 2 months. And what we will do, we just collect the patient. We have not enough patient in 1 year, 1 month, so we make the 2 months, and we make all the telephone numbers, we make the plan, and we collect them in our hospital and to provide that service. So this is the thing. And there's our money can do that, all the things. So we have a lot of organizations. There's Tilganga, some Swiss project, KISS Hospital, Bulletin Hospital, HRDC, Zorpati Hospital, this all BP Community Hospital, it is all the hospitals, they are helping to us. Next please. Then we have done, it is very difficult. म भन्छु 2003 मा मैले पाठेघर झरेको बिरामीहरू देख्दाखेरि त्यो 2 दिन हिँडेर 1 दिन हिँडेर पाठेघर झरेको बिरामी छान्न जानु पर्थ्यो। ओखलडुङ्गा जिल्ला त म 45 दिन हिँडेको छु, 3 दिन लगाएर 5-6 सय छानेको थियो। रामेसाब त कति वर्ष हिँड्यो थाहा छैन। अनि म यहाँ जुन मैले कथा भन्नै पर्छ, म यहाँ भन्न आएँ डाक्टर साहबहरूलाई, डाक्टर साहब त्यहाँ त यति धेरै छ, अपरेसन गर्ने क्याम्प गर्नु पर्यो भने तपाईँलाई चाहिँ क्या भन्नु भने कहीँ रामेसाबमा अपरेसन हुन्छ, हामी धेरैजना यहीँ त्यस्तै अलि बौलाउने मात्रै त्यहाँ बस्छौँ, किनभने यसरी बौलाइकन नयाँ काम हुँदैन। अनि के मैले डाक्टर साहबले भने त्यस्तो पनि कहीँ हुन्छ भन्नु। त्यसपछि के भयो भने मैले खोज्दै हिँडेँ, तर मैले एकजना मान्छे भेटेँ, डाक्टर गणेश बङ्गाल, उहाँले एउटा क्याम्प सङ्घर्षमा गर्नुभएको छ, 30 जनालाई गर्नुभएको छ। त्यसपछि मैले त्यो भेजालाइजेसनको क्याम्प गर्न सुरु गरेँ, फ्री गाउँमा गएर छान्ने अनि अपरेसन गर्ने मान्छेलाई त्यहाँ। यसरी हाउ वी आर डुइङ द्याट, दिस अल थिङ्स लाइक द्याट, द क्याटराक्ट सर्जरी बाई द तिलगङ्गा, the surgery is going on today also. Yes, there are 3 days. They are doing 150 around, I think. And minor surgery and dialysis we have there, and minor orthopedics, surgery, upper GI endoscopy, eco services in that very remote part of Nepal. Next please. And there is a lot of resources. They gave all the materials, some money, some equipments, and we are doing like that. Next please. These are all the resources. Next please. And visualizations, I've already told you about this. Next please. Now conclusion. It is like we can do. I think we can do. There is like challenges, but there is opportunities, and we can do. These are all the things we have to collaborate. We have to just go there to tell them our like what we have the problems. So we can do all the things. You cannot imagine, we started our health insurance in our hospital in 2005. What we did, the government did it very late. What we did, we have 30,000 members in the saving credit society, and they have to pay for some money, and we provide them service for them. That only 100 rupees, we are providing 3,000 rupees service free of cost in 1 year. And they have not any idea that where the money is coming for the free health service. 100 rupees just picking from their account to the hospital account. Finished. It was like that. We started the institute like that in that places. So these are all the things what we did. Next please. Now the recommendation. I am talking about only the experience of me, but to do the whole Nepal, we have to restructure the organization chart, government and mentality. The government must be the facilitator, but they are coming like a ruler. That is the difficult. They are not a ruler, they are the facilitator. But who are doing good, they have to encourage them. Who wants to do, they have to encourage them, but not like that. So, this is one my recommendation. And तपाईले सुन्नु भएको होला औषधिको टेन्डर हुँदा जसरी सिमेन्ट किनिन्छ, जसरी रड किनिन्छ, त्यसै गरी किनिन्छ। अहिले चाहिँ के छ भने तपाईको गभर्नमेन्टको जो पोलिसी छ त्यो चाहिँ रड किने जस्तै छ औषधि किन्ने। मलाई के लाग्छ भने यस्तै भइरह्यो भने अब अर्को 5 वर्षभित्र नेपालको क्वालिटी मेडिकल प्रोडक्सन गर्ने कम्पनीहरू चाहिँ सबै बन्द हुन्छ। सबै त्यो 7 रुपैयाँको औषधि 2 रुपैयाँमा टेन्डर गरेर 2 रुपैयाँको औषधि गाउँले पाइरहेछ। अहिले झगडा पर्छ अस्पताल र गभर्नमेन्ट अस्पताल र जनताको बिचमा अहिले गाउँमा झगडा छ। त्यो औषधिले कामै गर्दैन। यो चाहिँ सबैभन्दा डेन्जर छ। सबैभन्दा डेन्जर छ। यसलाई हेर्नै पर्छ। अघि नै भनिहाल्यौँ रिमोट प्लेसेसमा अब हामीले गर्दाखेरि त कति ठाउँ गुहार्नु पर्यो एउटा सानो अस्पताल बनाउनलाई। युकेको मान्छेहरू, जर्मनको मान्छेहरू, फ्रान्सको मान्छेहरू, विभिन्न एनजिओहरू, आइएनजिओहरूसँग भनेर हामीले रिसोर्सेसहरू ल्याएर बनायौँ। तर गभर्नमेन्टकोमा चाहिँ बायोमेडिकल इन्जिनियर भेट्न पनि गाह्रो छ। मेडिकल नर्सिङ, पब्लिक हेल्थ, हेल्थ केयर म्यानेजमेन्ट यसको चाहिँ स्कलरसिप गाउँमै दिए हुन्छ, जिल्लामै दिए हुन्छ। जिल्लामा दिएर उनीहरूलाई त्यही काम लगाए हुन्छ। धेरै गरिब विद्यार्थीहरू छ। मैले धेरै विद्यार्थीहरू पढाएको पनि छु त्यसैले। धेरै गरिब विद्यार्थीहरू छ, तर ती विद्यार्थीहरूलाई केही गाउँमा 4 वर्ष 5 वर्ष उसले काम गर्ने गरिकन हामीले डेभलप गर्दै गयो भने पैसा त धेरै छ सरकारसँग, लोकल बडीहरू छ, तर यसमा खासै धेरैको रुचि देखिँदैन। अनि हेल्थ इन्स्टिट्युसनहरू म्यानेजमेन्ट भएको चाहिँ हेल्थ केयर म्यानेजरहरू कोही पनि छैन। त्यो अयबाबाट यसो अफ द रेकर्ड है, यो हेल्थ केयर त्यो अयबाबाट हेल्थ इन्स्टिट्युटबाट गर्दै गएको मान्छेहरू छ। अनि म्युनिसिपालिटीहरूमा गचक हाकिम भएर बस्छ। त्यसपछि उसलाई त्यसको बारे केही पनि थाहा छैन र अपर्च्युनिटी फेरि हाम्रो त्यही छ। हाम्रो हेल्थ केयर म्यानेजरको अपर्च्युनिटी त्यही नै रहेछ। हामी कसरी छिर्ने भन्ने मात्रै कुरा हो। म भरे मेरोमा कुरा गर्छु, मैले कुरा चाहिँ कसरी छिर्ने भन्ने कुरा। तर के छ भने अपर्च्युनिटी एकदम छ, एकदम ग्याप छ। हाम्रो जस्तो अर्गनाइजेसनले एनओसी जस्तो अर्गनाइजेसन धेरै चाहिन्छ, तर के छ भने जहाँ चाहिन्छ त्यहाँ छैन, जहाँ चाहिन्छ त्यहाँ छैन। त्यसैले गर्दाखेरि यो नगरेसम्म अहिले मैले भनेको माथिको जति रिकमेन्डेसनहरू छ, मैले गाउँमा मात्रै कुरा गरेको होइन, स्वास्थ्य मन्त्रीसम्मलाई तालिम दिनुपर्छ हाम्रो एनओसीमा ल्याएर। किन हाँस्नु भएको? सही कुरै त्यही हो होइन, तालिम दिनुपर्छ कहाँदेखि भने तलबाट माथि। र यसरी हामीले काम गऱ्यौँ भने हाम्रो एक्सपिरियन्सले गरेको 40 वर्ष अगाडि गरेको एक्सपिरियन्सले कमसेकम रुरल हेल्थलाई, नेपालको रुरल हेल्थलाई अलिकति चेन्ज गर्न सकिन्छ कि भन्ने मेरो कुरा छ। थ्याङ्क यू।